And I'm gonna do my hand hygiene. All right, my name's Caitlin. I'm gonna be your student nurse today. I'm gonna be with you for about 10 to 15 minutes. I'm just gonna be doing a head to toe assessment. Do you have any questions for me?
No.
Okay, perfect. And then to start off, what's a good name and date of birth?
Lyndon Matthews, 02-25-05.
Perfect. And then do you have any allergies?
No.
Okay, good to know. So first off, I'm just noticing my patient's posture. She's sitting upright. She doesn't seem to have any leaning towards one way or the other. I'm also noticing her mood and her behavior. She seems to be in a good mood, I guess. She's smiling. She's been engaging in some conversation with me. And then I'm also noticing her hygiene. She seems to be clean and well kept. I'm not noticing any dirtiness or anything like that. She seems to be wearing the correct clothes for the season as well. And then, are you currently in any pain right now?
No.
Okay, so out of scale from like 0 to 10, you would say 0?
Yes.
Okay, perfect. And then I'm also not noticing any lines, tubes, or draining. To start off, I'm just gonna ask you a couple questions. Do you know where you are right now?
Yeah, I'm in the sorority house, Springfield, Missouri.
Perfect. Do you know what today's date is, or at least like what day of the week it is?
It's Monday.
Okay, perfect. And then do you know who the president is?
Yeah, it's Trump.
Okay, perfect. All right, so she seems to be alert and oriented ×3. She's answering all my questions. She's not seeming to have any concerns there. And then I'm just gonna have you smile for me. Perfect. The smile's symmetric and equal on both sides. And then I'm also I've been assessing her speech. She's, again, had clear speech with me, conversations and everything. And then I am gonna assess your strength. So I'm just gonna have you hold my hands. And I'm gonna have you pull me towards you and push me away. Perfect. And I'm gonna have you push your head against my hand, whatever. And then the other side. Perfect. And I'm also gonna have you put your feet out a little bit. And I'm gonna have you pull your toes up and then push down on the pedals. Perfect. The strength was strong in all of the 4 extremities. And then now I'm just going to check your sensorium. So I'm just gonna use my pen light and I'm gonna tap a different part of your body, and I'm just gonna have you tell me which side and what part it was, okay? So if you can close to your eyes for me.
Right arm, left leg, left arm, left leg.
I'm also gonna touch your face, just warning.
Forehead, left cheek, nose, right cheek.
Perfect. The sensorium was good in all of the regions, the lower, upper, and the head. And now I'm just gonna go ahead and do a quick head and face assessment. So I'm just gonna look in your hair first, if that's okay.
Mm-hmm.
Okay. So I'm looking, noticing there's no lesions. I'm not noticing any redness, any irregularities in the skin and the hair growth. All right, perfect. And now I'm just gonna look at, also your head is neurocephalic, which is what we're looking for too.
Okay.
Now I'm just going to look at your eyes. So I'm just gonna have you look at me. I'm gonna shine the light. Perfect, and I'm gonna do the other one. Perfect, so your pupils are round, they're reactive to the light, they're equal in size, and they were also accommodating, which just means that they were dilating and everything.
Mm-hmm.
And then do you have any glasses or contacts that you wear?
No.
Okay, perfect. And now I'm just gonna look at your eyes. Could you pull your eyelids down real quick? Perfect. All right, the conjunctiva is pink and moist. The eyelashes look well kept as well. I'm not noticing any crust, any drainage or anything, no abrasions on the eyes or anything. And then I'm also just gonna check your ears as well.
Okay.
And I noticed, do you have 2 piercings?
Yes.
Okay. On both sides?
Yes.
Okay, perfect. All right, yeah, I'm not noticing any drainage out of the ears or the piercing sites, and I didn't see any obstructions. And do you have hearing aids?
No.
Okay, perfect. So no hearing deficits. Okay, good to know. Right, and then now I'm just going to look in your nose. So I'm just gonna shine a light just to make sure there's no obstructions. Sorry if it's in your eyes, sorry. All right, no obstructions in the nasal airways. I didn't see anything there. And then also, could you close one nostril and breathe out for me? And then do the other side as well. Perfect. I didn't see any flaring or any abnormalities there. And then I'm also gonna have you open your mouth, and I'm just gonna check out Perfect. Again, oral cavity is moist and pink. I noticed that there's no lesions, any abrasions in the mouth. The tongue is center in the midline. I think that's it for that. So now I'm just gonna move on to the cardiovascular. So it's okay. I'm just gonna have you put your hands out like that. I'm gonna check your cap refill. Do it again. Perfect. Less than 3 seconds. And then I'm also gonna do it on your toes. Less than 3 seconds again. Perfect. All right, so all the cap refill were less than 3 seconds, which is exactly what we're looking for. And I'm also just gonna have you hold out your arms like this. I'm gonna assess your pulses. I'm gonna lift your, so this is your radial first. Perfect, that was normal. There's 2+ strength-wise. I'll lift this up just a little bit more. I'm gonna do the same on your brachials. Again, 2+, strong and equal. And then I'm also gonna do your pedal pulses real quick. Perfect. So all of the 3 places where I checked, they were all strength and equal of 2. And then I am now going to listen to your heart real quick. All right, so I'm gonna start on this side. Perfect. I didn't hear any abnormal sounds, any extra sounds. It was clear sounds. The strength was, again, the same in all the 5 places. And then now I'm just gonna have you look off to that side for me, and then go ahead and look this way. Thank you. Perfect. Didn't see any jugular vein distension. And then now I'm just gonna palpate and feel your carotid arteries. So I'm gonna do this side first. I'm gonna do this side. Perfect. They were bilateral and equal again. And then I'm just gonna listen for what we call it bruits and swooshes. It's gonna be on your carotid again. Perfect. I didn't hear any, which is again what we're looking for. Right, and now I'm gonna move on to respiratory. So I've noticed that my patient's respiratory rate is between 12 and 20, which is what we're looking for. And then I also noticed that her work of breathing is unlabored. It's equal bilaterally on both sides. I haven't noticed any unsymmetrical factors, whether it be raising or lowering of the chest. And I also haven't noticed any concaving or barreling of the chest. Right, and now I'm just gonna listen to your lung sounds real quick. So I'll just listen to 4 parts, front and back, and whenever I place it, I'm just gonna have you take a deep breath, okay? Perfect, and then now I'm just gonna have you turn that way a little bit, or whichever way, yeah, that works. And I'll just have you lift up this arm for me. Deep breath. Perfect. And then now I'm just gonna do it on your back as well. All right, perfect. I didn't hear any wheezing or any pneumothorax, hemothoraxes, nothing abnormal that I shouldn't hear, and they were all crisp and clear. And then, have you recently had a cough or anything recently?
No.
Okay. And if you did, were to have a cough, if you had sputum, it would be pale yellowish, and that would be fine, just so you know. All right, so now I'm gonna assess your abdomen. So when was the last time you had a bowel movement?
Probably about an hour ago.
Okay, perfect. How many times do you normally have one a day?
Once.
Once, okay. And then how about urination?
Usually around 6.
Okay, 6 times. Okay, and like, this is weird, but how would you describe the urine? Like color, consistency?
Like light yellow.
Light yellow. Okay, and like no smell or anything. Okay, good. Perfect. So now I'm just gonna have you lay down and I will raise your shirt if that's okay.
Yeah, fine.
Oh, sorry. Perfect. So I'm noticing the abdomen, the contour. There's some there's some abdominal muscles that I can see. Other than that, I'm not seeing any like distension in the stomach. I've also noticed that it's flat in shape. All right, and then now I'm just going to listen to your stomach. So I'm gonna start here. All right, all 4 regions I heard. I did hear some hypoactive sounds, but it's just because you just had one, so it's okay. All right, and then now I'm just going to palpate, so I'm just gonna press on your stomach real quick. Just let me know if you feel any tenderness. Okay, perfect. I didn't feel any masses or anything. So you can go ahead and sit up now. I didn't feel any masses. I didn't feel anything that wasn't supposed to be there. All right, and then now I'm just gonna test your musculoskeletal system. So I'm just gonna test like your range of motion first. So I'm gonna have you turn that way again. And I'm gonna put my hands right here, and I'm gonna have you put your hands above your head. All the way up, perfect. Down to the sides, out beside you, and in front of you. Perfect. So I didn't feel any like abnormalities. I felt some of the tendons, but that's normal. That's just because you're moving around. And then I'm gonna have you look to the side, look to the other side, and then up and down. Perfect. Neck and spine also has good range of motion. And then I'm also going to place my hands right here, and I'm gonna have you straighten your legs. All right, and then bend them. Perfect. Didn't notice any issues there as well. So now I'm gonna have you stand up, and then I'm gonna just have you stand right here and walk over to the other side of the rug. Okay, it looks steady. And then I'm gonna have you turn around, and I'm gonna have you do heel to toe. Perfect. Again, gait is steady. I didn't notice leaning on one side or the other. And then I'll just have you sit back down again. Thank you. All right, so now I'm just gonna kind of assess your skin. I've been looking throughout the whole thing. You have a palish pinkish skin color. I didn't notice any like excess moisture. The skin was warm, which is what we're looking for. And then I am gonna ask for your hand real quick just to check your skin turgor. Perfect. So like about a centimeter raised, but it didn't stay, so that's also what we're looking for. And then I didn't notice any lesions, scarring, or anything throughout the body, any discolorations. All right, well, I'll let the doctor know that you're ready.
Okay, perfect.
Okay.
Thank you.
Yeah, hand hygiene.
Hello there.
Hi,
What's your name?
Stephanie.
Stephanie, I'm Jonas. I'll be performing your physical assessment today. I'm going to ask you questions before we go on. Can you tell me the month, please?
May
And you tell me the date?
5th,
Can you tell me the year?
2025.
And can you tell me who the president is?
Trump.
All right. So, patient is a well-developed female in her 40s. She is of appropriate appearance. She is alert and times 4 and appears appropriately developed for her sexual maturation. We're gonna continue with the physical assessment. Let me just wash my hands here and use some hand sanitizer. And then we're gonna begin. I'm gonna look at your scalp and your hair, look for any abnormalities. Scalp is not dry, not too oily, no lesions, no nits. Hair growth is normal. Hair is thick, with no patches. All right. And while I'm here, any pain?
No.
Okay. All right, we're gonna move on. Eyebrows, throw them in, no patches. I'm gonna look at your ears. Okay. All right, oracle, normal. Tragus, normal. Okay. Same for the right. Okay. And examine the inside of your ears. Okay. No drainage. Sometimes membrane intact. Right side, no drainage. Membrane intact. Okay. I'm gonna look at your eyes, okay?
Mm-hmm.
First off, eyelid and folds, eyelashes, normal growth. Okay. I'm gonna look at your tear ducts. And open your eyes, please. Okay. Sclera is white. Sclera is white on the right side. And I'm going to look at your conjunctiva, pink, moist, no drainage. And same for the right. Okay. Now I'm going to look at your pupils, okay?
Mm-hmm.
All right, so first off, open your eyes, please. Pupils, round, reactive. And now I'm going to look at this side. Central reflex present. And now let's go on this side. Pupils round, react to light. And let's see. Central reflex present. Okay. Now we're going to check your vision. I want you to look at my pen.
Mm-hmm.
All right, follow it. Follow it. All right, pupils accommodating appropriately. All right, now I want you to follow my pen with just your eyes, okay?
Okay.
Ready? All right. Alright, very good. Alright, now I'm gonna have you look at this chart over here,
Okay.
and I want you to read line 4.
With both eyes?
Cover your right eye.
Okay.
Alright, go ahead and read line 4.
LPED.
Alright, now cover your left eye. Now read line 6.
EDFCEF. P.
Alright, now open both eyes. Now read line 7.
FELLOPED.
Alright, good. Alright, so now I'm going to look at your nerves. Okay, first off, tip your nose, good. Alright, sniff. Any blockage?
No.
Okay, sniff. Any blockage?
No.
Okay, look here. No drainage. Septum. Midline. What do you smell?
It's not hand sanitizer.
Okay. And smell intact. Now I'm gonna look at your lips. Lips are moist, pink, no cracks. And I want you to open your mouth, please. Okay. Say ah. So move your tongue around. Alright. Up and down. Alright, no lesions, no masses present. Mucous membranes pink. Tongue, normal texture, no lesions present. Okay, so now I'm gonna check your sinuses, okay?
Mm-hmm.
Alright. Any pain here?
No.
All right. Any pain here?
No.
All right. So frontal and maxillary sinuses are normal. I'm going to check your lymph nodes, okay? We're going to go several places. Okay. Nothing here. All right. Show your shoulders for me. All right. Lymph nodes equal. No swelling. All right. Now I want you to lift up your shoulders. Okay. Down. Good. Now I want you to turn your head left and right. Okay. Any pain?
No.
All right. No crepitus. Now roll your neck. Okay, good. Now I want you to press against my hand with your head. All right. Other side. Okay, good. All right, so now we're going to check your, lungs. So first off, chest is normal presentation. Anterior posterior ratio is 2:1, so normal. Any rashes or lesions on your chest that we should know about, that we should check?
No.
Okay. We're listening for lung sounds. So just take a breath every time I put down the diaphragm, okay? Go ahead. Okay. Go ahead. All right. Good. Okay. Right. So on the upper field, tracheal lung sounds present, then bronchial, vesicular lung sounds, then vesicular for the remaining fields. And listen up front. Go ahead. Okay. Tracheal lung sounds present up top, bronchial, vesicular, and the mid region, and the remaining lung sounds are vesicular. Okay. Now we're going to listen to your heart. All right. First off, we're going to go through each of the cardiac landmarks. First is the aortic valve. All right. And we're going to pulmonic valve. Erb's point. Cuspid. And then the mitral valve. Okay. And we're going to get the valve. Okay. I'm going to feel for maximum PMI. Okay. I'm going to palpate the pericardium. Good. So next. Now you lay back.
Wait, do you need to grab this one?
Mhm. So, you check your abdomen. Ultrasound. Sounds present in all 4 regions. I'm going to palpate. First, any pain here?
No.
Okay. Any pain here?
No.
I'm going to go a little deeper. Any pain here?
No. No. No.
And now we do some palpation. Okay, on palpation, sounds panic, normal. Let's sit up real quick. Alright, check here. Any pain here along the spine?
No.
Okay. Okay. All right. Let's lay back down. Okay. So now I'm just gonna do some quick range of motion exercise. Okay. Lift up. Any pain?
No.
Okay. Second kick. Okay. All right. Any pain?
No.
All right. Second kick. All right. Let's go back to your arms. Any pain?
No.
Okay. Pull back your arm, please. Any pain?
No.
All right, pull back your arm. Can you check your pulses? Excuse me. Pulses present. Cap refill less than 2 seconds. Skin is warm, normal color. Vertical pulse present. Okay. Normal rate. Vertical pulse is present. Okay. Vertical pulse present. Normal rate and rhythm. Check your abdominal pulses. Okay. Pulse present. Pulse present. Normal rate and rhythm. Okay. And check here. Level 2 pulse present. Okay. Level 2 pulse present. Come down here. Yourselves pulse present. Right. Okay. Present on left. Okay, check. Okay. Anterior tibials pulse present. And present on the right. Okay, quick cap refill. Less than 2 seconds. Quick cap refill here. Let's have you lift up your feet. Okay. Right, I'm gonna kick forward. Alright. So I'm gonna have you sit up. Okay. So now we're gonna have you stand. And I'm gonna have you stand here for 10 seconds. Keep your feet together. Okay. Alright. Okay. No swaying present. Now I'm going to have you close your eyes and stand still.
Okay.
Okay. Okay, no swaying present. Okay, so I'm going to have you fold your hands over your chest. Now bend your back this way, forward. Any pain or discomfort?
No.
All right, now I'm going to have you rotate in a circle like this. Any pain or discomfort?
No.
Okay, so I want you to stand over here and walk heel to toe to me. Good. Turn around, walk back. Gait is normal, patient is steady. All right, go ahead and take a seat again. Okay, so I'm gonna give you a phrase, right? And I want you to repeat it after me, okay? The phrase is, the dog bites.
The dog bites.
Okay, now repeat after me, the air is cold.
The air is cold.
All right, repeat after me, the fire is hot.
The fire is hot.
Okay, now I'm gonna have you count down from 100 in multiples of 7. Start with 100, go ahead.
So 100, 93, 85, 86.
Okay, go on.
We keep going.
Mhm.
70, what was it, 86?
Mhm.
So 79,
Okay, what was the first phrase I told you to remember?
the dog bites.
Very good. Okay, so that concludes our head to toe assessment. Thank you for participating. All right, and you have a good day.
Thank you.